What's up, YouTube? This is James coming back at you with another informative video. I hope everybody's doing well out there on this Saturday evening. I'm doing real good myself, and I hope you guys has had a very nice, relaxing Shabbat. Well, here's another red flag to add to all the rest of the red flags about this vaccine. Okay, that's what it comes down to. Now, to get into this story right here, it says Australia scraps homegrown COVID-19 vaccine after trial participants gets false positive test results for HIV. Okay. Wow. I don't know what they mean by false positive. You know what I'm saying? From the way it sounds, though, is they had some people who actually took this vaccine or whatever, get tested, and it popped up that they had HIV after receiving this vaccine. That is no good. Okay. Let's get into the story right here. The Australian government canceled its homegrown COVID-19 vaccine development plans for the University of Queensland on Friday after vaccine trial participants showed false positive in tests for HIV. The Australian vaccine was developed using a protein fragment of HIV called GP41 that's used to stabilize the inoculation. Okay, right there. They put the HIV fragment in the vaccine. That's even more, that's a wrap right there. Okay? Who wants to take a chance on getting HIV? Listen to this shit. To continue, the Australian vaccine was still in phase 1 trials with just 216 volunteer participants, but researchers had been working on development of this vaccine for nearly 11 months. The vaccine didn't show any other safety concerns aside from the false positive HIV test, but that alone would simply be unacceptable if it occurred in the general population. Of course, hell, it don't have to show any other messed up signs. Hell, that's enough right there. No? But I digress. Trial participants were fully informed of the possibilities of a partial immune response to the HIV protein fragment. But it was unexpected that the levels introduced would interfere with certain HIV tests. The University of Queensland announced in a press release on Friday. While on one in the study actually contracted HIV, their immune systems created antibodies to the virus, which showed up on HIV tests. Researchers at the University of Queensland knew about the HIV false positive for weeks and tried to find a workaround, but ultimately couldn't move forward with the trials after consulting with top officials in the government, according to the Brisbane Times. Australian government, federal government, which has invested millions of dollars in the vaccine development, was informed of the roadblock and only decided to pull funding sometime over the past 24 hours or so. The roughly 500 people who worked on the vaccine created were reportedly devastated their work wouldn't continue, as one can imagine. I'm going to add this. Fuck y'all devastation. Number one, you evil, low-life piece of shit. They want to force this vaccine on people, man. And this shit got HIV in it. Hell to the no. Listen at this. Man, this is crazy. To continue, I said at the state of vaccine development that there were no guarantees, but what is really encouraging is that the core technology approach we use has passed the major clinical tests. The University of Queensland vaccine co-lead Professor Paul Young said in a statement published online, "It is a safe." Let me repeat this. Paul Young said it is a safe and well-tolerated vaccine producing the strong virus neutralizing effect that we were hoping to see. So we will continue to push forward, and we are confident that with further work, the molecular clamp technology will be a robust platform for future vaccine development here in Australia and to meet future biosecurity needs. These people are, man, I can't call them people. These are not people. These are not people. There's something else, that's a little lower than people. I'm going to just leave it at that. To continue, the University of Queensland and its partner organizations will now pivot to manufacture the UK developed AstraZeneca vaccine under license for Australia's population of roughly 26 million people. Australia has already purchased 10 million doses of the Pfizer vaccine, which should be available in March, assuming it gains regulatory approval in the country. But even without a vaccine, Australia has fared relatively well during the COVID-19 pandemic. Australia has reported just 28,012 cases of coronavirus since the pandemic began earlier this year, and just 908 deaths, according to the latest figures from Australia's Department of Health. Victoria, Australia's second largest state, had a bad second wave of the pandemic flared up in July. But the state government imposed a strict lockdown for 3 months that effectively eliminated the virus in the entire country. Australia hasn't had community spread of the disease for 7 days, and life is largely back to normal for most people. Well, then y'all better do another lockdown then, a strict one, because taking that damn vaccine gonna be worse, as far as I'm concerned, than the coronavirus in itself. In conclusion here, the U.S., the worst hit country in the world during the pandemic, has reported 15.6 million cases as of Friday morning and over 292,179 deaths. Wow. The U.S. saw 3,076 deaths on Thursday alone, according to the COVID tracking project, higher than the number of people killed during the terrorist attack of September 11, 2001. And experts warn those deaths from Thursday are mostly people who were infected in mid-November, notably before Thanksgiving, a super spreader holiday that's expected to show up in the official death statistics in the coming weeks and months. Every respected public health expert in America is warning people not to travel for the Christmas and New Year holidays. All right. But Americans didn't listen to those same warnings during Thanksgiving. Travel by car fell just 5% on U.S. roads over Thanksgiving weekend. All right. Wow. Well, one thing's for sure. It's definitely a no-no for this fucking vaccine, man. This shit got HIV in it. And people can test positive after taking this clinical trial test. What have you. You see it for yourself. I don't know. I still don't understand all this false positive, saying, in other words, well, they got it, but the test was false. They really don't have it. I don't get it. All I know is this. Fuck that vaccine and all of that. You know what I'm saying? And this, like I said, major red flag, Y'all tell me what y'all think about this story. I'm interested in hearing your thoughts, your views and opinions on it. Like, comment, share, and subscribe. People, please remember to live your life as though we are being watched. Simply because we are. This is James, and I'm out. Peace.